Hello dear learners. We are well familiar with the fungal infection and we have also heard many times the people speaking about the fungal infections. So the agents which are used to treat this fungal infection are called as antifungal agents. So today we are going to study these antifungal agents in detail. The learning outcomes of this presentation are: after viewing this presentation, the learner will be able to define antifungal agents, classify antifungal agents, and third, outline different antifungal agents like undecylenic acid, Tolnaftate, Nystatin, Amphotericin B, and Hamycin. So let's proceed. The content of this presentation are: we are going to see introduction to antifungal agent, then classification of antifungal agent, and drugs which will be studied in this presentation are undecylenic acid, Tolnaftate, Nystatin, Amphotericin B, and Hamycin. Introduction to mycosis. Fungi, these are the heterotrophic microorganisms, and this fungus mainly grow at the moist places. So when this fungus grows on a human body, it causes itching, irritation, reddening of the skin, and other few symptoms. So, and this fungal infection is a communicable too. So, the infection which is caused by the fungus is known as mycosis. This mycotic infection in the human involves two types. First is dermatophytes and candidiasis. Dermatophytes, it is a contagious superficial skin infection and it is limited to the epidermal region only, whereas skin and mucous membrane are affected in candidiasis. Antifungal agent definition: the agent or the drugs which are used to treat mycosis are called as antifungal agents. These antifungal agents are classified as follows. First, synthetic compounds. Synthetic compounds are further subdivided into carboxylic acid and their metallic salts. Example is undecylenic acid. Second is dyes. Example is crystal violet or gentian violet. Third subclass is phenolic compounds and example is salicylic acid. Fourth subclass is amides and example is stilmadine. Next is thiocarbonylic acid derivative, example is tolnaftate. Azole and imidazole derivative, example is miconazole and cotrimoxazole. Second is natural agents. So these natural agents are further classified as antibacterial antibiotics, example is griseofulvin. And second, polyny antifungal antibiotics, example is tetranes, pentanes and heptanes. So example of tetranes is nystatin, example of pentanes is pentamycin, and example of heptanes is Amphotericin B. So now let's study the examples in detail. So first example which we will be studying now is undecylenic acid. So this undecylenic acid, it is colorless or pale brownish clear liquid or white to yellowish white crystalline mass. It has an characteristic odor. This acid is practically insoluble in water but miscible in alcohol and chloroform. Storage condition. It is stored in tightly closed light resistant containers. This undecylenic acid, it is used as topical fungicidal. It is also used internally to treat psoriasis and neurodermatitis. Its official preparations are zinc undecylonate ointment IP. It is known by the brand names as Blistosol, Clandestine and Cruix. Second example is Tolnaftate. So Tolnaftate, it is a white or creamy white powder which is odorless or has a slight odor. It is practically insoluble in water and it is slightly soluble in alcohol and freely soluble in chloroform. It is also stored in tightly closed containers. Uses. Tolnaftate, it is used as an antifungal agent. It is used as a prophylaxis and treatment of various forms of ringworms. It is also effective against skin and mucous membrane. It is known by the brand names as Tanicidal, Multiderm and Mycil. Now, Nystatin. Nystatin, it is a yellow to light brown powder and it has a cereal-like odor. It is very slightly soluble in water and alcohol. Storage condition for Nystatin is that it is stored in tightly closed light resistant containers. Uses. Nystatin is used as a prophylaxis and treatment of candidiasis of skin and mucous membrane. Second use of Nystatin is it is used for the treatment of intestinal and esophageal candidiasis. It is also used to treat the candidiasis of mouth and vagina. Nystatin is known by the brand names as Nystat, Nystaform, Mycostatin, Nystop and Perideri. Next example which we will see is Amphotericin B. The Amphotericin B is a yellow to orange powder which is odorless and tasteless. On the basis of its solubility studies, predicts that it is practically insoluble in water and in alcohol. It is soluble in dimethyl sulfoxide and in propylene glycol. It is to be stored in tightly closed light resistant containers. Uses. Amphotericin B, it is effective against severe systemic mycotic infections including candidiasis, blastomycosis and phycomycosis. It is also used in treatment of mucocutaneous and cutaneous candidiasis. It is used to treat primary amoebic meningocephalis. It is also used for the suppression of oral and intestinal candidiasis. It is known by the brand names of Fungizone, Fungalin, Ambisone and Amphotericin. Next example is Hamycin. It is also known as Hamycin. It is yellow amorphous powder which is practically insoluble in water and in chloroform. It is soluble in pyridine. Storage condition for Hamycin is it is stored in tightly closed light resistant containers. It is used as antifungal and anti-trichomonal activity. It is used topically and orally in various fungal infections, and the brand name by which it is known is Hamycin. So here we conclude our topic antifungal agents. Thank you all.